So another issue that we've run into, I know you've had some cases and I've had some cases, but with high pulmonary artery pressures, above 70, used to be, even doing pulmonary angiograms back in the days used to be kind of a relative contraindications. What's been your experience with elevated pulmonary artery pressures, and has there been any other data that's come out to show that it's safe to treat patients with elevated pulmonary artery pressures above 70?
That's a great question. It's something, since my fellowship days, we're always concerned about that. We're worried about doing power injections in some patients with elevated PA pressures. And I think you do have to be careful about that.
Yeah.
And one of the questions that, often has come up is it safe to put a large bore aspiration thrombectomy device in these patients?
Right.
Is that safe? And, as you know, you and I have done some live cases that I set together.
Yep.
And that's, often a question that comes from the panel. And I've even had people say, hey, that's not safe, or I've seen issues. But I'd like to really rely on science. If we're gonna make decisions on these things, if we have data to support it,
yeah,
then we should rely on that. And if you look at the FLASH study, which is the largest interventional study to date, which has been done in the PE patient population, by 800 patients, and about 100 of those patients, I think it was technically 99, had severe pulmonary hypertension pressures over 70.
Yeah.
And then you compared those to the rest of the cohort. If you look at the adverse events, all of the outcomes were exactly the same,
Right.
whether the patient has severe pulmonary hypertension or not. So, I adamantly believe that patients with elevated PA pressures, it's not a contraindication. In fact, the patients do quite well.
Right. Yeah, with elevated pressures like that, it's not that can't be an acute. They have to have some sort of a pre-existing pulmonary artery hypertension, and I think that kind of lends itself to the rationale for why it is that way. So, do you take any other precautions when the pulmonary artery pressures are the same, or do you kind of treat the patients the same way?
I think there's a few things that I do. I think you and I probably practice pretty similarly, but I always go in there, first thing I do is check the PA pressures.
Right.
And if the pressures are elevated, I don't really see a point. I used to, take a bunch of angiograms. I think some of it was so I wanted to really understand it.
Sure.
But over time I realized, what is the point in doing an angiogram?
Yeah.
I could make the patient worse. The pressures are high, I just go immediately up with the flow retriever and start aspirating.
Right. Yeah.
And then if the pressures are lower afterwards, then I'm fine doing it.
Kind of base your treatment on the CT where the clots are.
Correct, exactly.
Yeah, that's kind of what we've gone to too.